Hi, my name is Taron. I'm one of the scientists here at Hardy Nutritionals. Today I'd like to talk about another one of the possible limiting factors, and that's the interaction between the micronutrients and non-psychiatric medications. We've had individuals that reported back to us that have undergone surgeries, whether general anesthesia or local anesthesia, that often, or that in some cases, they seem to have potentiated effects after the administration of those medications. It's not unusual also during particularly procedures that require general anesthesia that they're also co-administered benzodiazepines, which is a sedative, a very powerful sedative, and sometimes there's some side effects that can be associated with that. Often individuals can have psychotic symptoms, manic symptoms, and sometimes even depressive symptoms. So that's just something to be aware of, that some individuals can have those kinds of interactions. There are reports in the literature as well that individuals that have a tendency towards bipolar symptoms will often have reactions to anesthesia. So again, that's something else to be aware of. Another category of non-psychiatric medication that can interact with or alter the experience of the micronutrients are antacids. We know that antacids affect the digestive process, and that can ultimately affect the absorption of the nutrients. And so that's something, again, to be aware of. Also, antibiotics are a category of medications that can affect how nutrients are absorbed from the body. In fact, the use of antibiotics is significant enough that if one is taking antibiotics, we recommend that you increase your dose of the nutrients by 50%, just to compensate for that lowered rate of absorption when taking them together. We have had individuals report that when they've taken antihistamines, that they can have increases in anxiety, increases in manic-like symptoms, even some psychotic type symptoms when they've used those together. We've had similar reports from individuals who've used birth control and also from individuals who take hormone replacement therapy. There just seems to be quite a strong interaction between the effect in the body on the nutrients, where it enhances and optimizes systems, and the potentiating effect of a medication. So we hope at least that this kind of information is helpful. We have had reports that individuals using pain medications, and again, it depends on the individual and the situation, but pain medications can cause the same kinds of things. We've seen that individuals who are experiencing pain seem to have a different experience than those who may be habituated to or potentially abusing pain drugs. Their experiences are different. The individual with pain seems to be able to function more normally and have a more quote-unquote normal experience using the micronutrients or using the vitamins and minerals compared to those that have their bodies have begun to tolerate the drug, and they need a higher dose in order to compensate or feel the same effect. So we hope, though, that this information gives you insight and into how to use the nutrients more effectively, or how your experience may change if you happen to need or are prescribed some of these other non-psychiatric medications, and it helps you have a better experience or a better understanding of what you may anticipate happening when you use the two together.